Hi, I'm Beatrice. I'm a Hong Kong registered clinical psychologist and a advanced certified schema therapist with the International Society of Schema Therapy. I wish to introduce you what is schema therapy. Schema therapy is good for focusing on some pervasive pattern in your life. It's something that's running through everything. It's like a theme in your life. For example, some people have a strong sense of abandonment, which applies to all close relationships that they have. Schema therapy helps us to be aware of these schemas we develop because of the unmet emotional needs in our childhood. It's like when we get hurt when we were small, we try to make sense of it with our little brain. Perhaps to make up a way to tell a story that explains why the bad things happen to us. So it gradually becomes our life story and in turns affects how we think and react to things. That's why it's usually very pervasive and often related to attachment issues. Schema therapy is about letting us aware so as to learn and operate in a healthier way to meet our needs adaptively. Schema therapy is originally developed in the 1980s by Dr. Jeffrey Young. At the time, he was working in the Cognitive Therapy Center in the University of Pennsylvania. He realized that for those patients with more pervasive behavior patterns or personality disorder, he did not see more long-lasting changes. Therefore, he begins to develop schema therapy. He took multiple therapy techniques and integrated into this one unified approach. To understand schema therapy, you need to have some basic concepts. There's 4 basic concepts. The first one, emotional needs. What is basic emotional needs? We all have basic emotional needs since we were a baby, like protection, as we need to feel safe. We need warmth when we feel cold. We need to be fed when we were hungry. We need our emotions to be attuned and recognized, as well as soothed so that we learn to self-soothe. When we have some emotional needs that's unmet, we will develop some early maladaptive schema. The second concept, early maladaptive schema, is like a story or a belief about ourselves, how we relate to people and the world, and it's like a theme in our life. It basically affects how we think, what we feel, and how we behave. For example, for someone with defectiveness schema may be very caught up with the idea of I'm not worth loving. So he may have difficulty to express his needs because he felt unworthy. So there is 18 maladaptive schemas. The third concept is maladaptive coping style. With our schema, we develop our coping mechanism. It helps us to go through really tough times. For example, someone experiencing abuse may be dissociated, which is an extreme form of experiential avoidance in order to survive through those hard times. Therefore, abused clients often have very limited or fragmented childhood memories as they have lots of dissociation. Those coping mechanisms were developed to protect us, to serve us with a purpose when we were small. However, they may also be the coping that no longer serving us right now as an adult. These copings can be shaped by our temperament or we learn from someone around us. Roughly speaking, there are 3 kinds of coping. Number 1, surrender. We submit to our schema. We act according to our schema. Number 2, avoidance. We avoid or escape from our schema. Some people may develop some coping behaviors like addiction, drinking, drug use, or cutting. Number 3, overcompensation. We do the opposite of our schema. We act like we are arrogant because deep down we felt shame. Some mental illness like OCD, eating disorder can also be related to this mechanism. Now we go to the 4th concept, schema modes. It's like a state of mind we go to when we are triggered. Some people may have the same kind of relationship issue repeatedly happen in their life. When all things come together consistently, that our brain has a mode that we go into. It's a kind of like our brain is so used to how to think or react every single time when the same theme is triggered. So our brain somehow wired that way. So many people will be automatically cut off to avoid or dissociate whenever they were triggered. This response becomes automatic or even unconscious. There are up to 10 different kinds of modes. So, schema therapy is about to unpack and identify those schemas we have and how we develop those schemas. What are the modes that we go into when we are triggered? So end up we can resolve our life challenge with more adaptive way to meet our needs. As schema therapy is integrated from many different therapy, such as CBT, EFT, ACT, psychodynamic theories, Gestalt therapy, mindfulness. You may experience many different therapy styles. Your therapist will likely use very experiential techniques, such as chair work. You may sit on multiple chairs to enact your modes or schema. For example, for a client with eating disorder, may in fact talking to her eating disorder, which manifests into many different modes, and ask why it's sticking on her and how the eating disorder finds herself useful in controlling a client's life. Other experiential approach that is like imagery rescripting, which help our clients to flow back to their childhood experience and bringing in the healthy adult mode to go and into it. The most important thing is the therapist will also use the therapeutic relationship to work with the clients. So any transference will likely be discussed. That's also why it requires the therapist to be very self-reflective.